Good afternoon. Thank you for spending some time with us this afternoon. My name is Tammy Thien, and I'm going to talk to you a few minutes about the effect that COVID-19 has had on our children and adolescents. We knew early last spring as behavioral health experts that shutting down our schools, and the lack of contact with friends for our children and adolescents, the loss of milestones like birthdays, graduations, the cancellation of sporting events, all of those important events for teenagers and adolescents, that we were going to have some problems. Now the numbers are coming in, and in some ways, they're worse, I think, than experts that had feared. Experts are calling this a pandemic among a pandemic from a pandemic. We knew that that COVID-19 had affected adults physically, but emotionally, teenagers and adolescents have been hit just as hard, and the long-term effects are not going away anytime soon. For this pandemic, we're not going to be able to take a vaccine and make it go away. It's here to stay for a while. Next slide. Pre-pandemic, 1 in 3 adolescents met criteria for an anxiety disorder by the age of 18. And prior to COVID-19, as many as 1 in 5 children had a diagnosis of a mental health disorder. You know, the teenage years are a time of changes, peer pressure, confusing feelings. It's a time when the teenagers are going through puberty. There's a lot of hormonal changes. So it can be very difficult to be a teenager with all the pressures. And then you add on a national pandemic, and it has caused a lot of trauma to teenagers that we're going to see, you know, a lot of problems that our children and teens are going to need some help to overcome. Next slide, please. Now we're going to talk some about ED visits related to mental health. Heightened stress, school closures, loss of income, and social isolation resulting from the pandemic have increased the risk for child abuse and neglect. Official reporting of child abuse and neglect actually started declining 20 to 70% in some states since the beginning of COVID-19, attributed to the decrease in contact with mandated reporters such as education staff, child care workers. So the first graph, you can see that actually the ED visits declined to almost zero in the beginning of the pandemic. But then when the pediatric visits were pulled out of the mental health related visits, you can see that there was a steady increase from 2000. You can see the difference between 2019 and 20, what a steady increase that there was if you look on the second graph. And I want to share with you some information that I just read this morning that I found very alarming in a study by a nonprofit investigators. They combed through a database of 32 billion US health insurance claims focusing on 2 billion or so 2019 to 2020 files from pediatric age groups. And some of the numbers are startling. This is the number that was so startling to me. There was a 334% spike in intentional self-harm behaviors among 13 to 18-year-olds in August of 2020 compared to the same month the year before. That was in the Northeast region of the United States. That was just startling to me, that big at 334% spike. So that was definitely attributed to the increase in the ED visits. Next slide, please. And then we broke it down into age groups. The 0 to 4 years of age groups, you can see there were some spikes in weeks, but not as steady as an increase as the 5 to 11 and the 12 to 17. 5 to 11, there was a 24% increase from 2019 to 2020. And then the 12 to 17, there was a 33% increase in ED related visits to mental health. Next slide. ED visits related to child abuse. We would expect, because of all the increased stress of people losing their jobs, their income, being isolated at home, that child abuse would be up, that domestic abuse would be increased. But after the president actually claimed a national emergency, ED visits related to child abuse, next slide please, actually went down to almost zero in the coming weeks after he declared the national emergency. Next slide. But then when they pulled out the visits that were visits ending up confirmed or suspected abuse that actually ended up in being hospitalized, you can see how much they had increased. So by the time these kids actually made it to the hospital for their injuries, they were severe enough that they needed hospitalized. Next slide. So there definitely has been an increase in suicide. Last summer, the CDC reported that 1 in 4 adults had contemplated suicide in the previous month. So we won't have the official numbers for suicide until about 2022, for 2020, but just the numbers that we've got coming in from individual states, I mean, they're alarming. Just for instance, Clark County School District that is in Nevada. During a 9-month period when their school was closed, they had 18 suicides during that 9-month period. That is up 50% from from 9 months before that. The youngest child that took his life was 9 years old. A 9-year-old boy at home in isolation took his own life. He thought he had nowhere else to turn but to take his own life, a 9-year-old. And there's more stories out there as kids as young as that, but that's just one example. Many more states, Pima County in Nevada, no, I'm sorry, I know where Pima County is, in Arizona, they report a 76% increase in suicides. Elementary schools all over the United States are bringing in pet therapy dogs because their young children, elementary school age children, they have increased anxiety. And all the hospitals across the states are reporting increased suicide attempts that are coming into the emergency rooms. Next slide. Loss of a parent or grandparent. As of February 2021, an estimated 40,000 children had lost at least one parent due to COVID-19. Those children most of those children were not able to say goodbye to their parents. They weren't able to have the same support, their extended family around them to support them with the grieving process. Those children, we know that grieving can be a lifelong process, but to lose a parent during a national pandemic, those children are going to need specialized bereavement, counseling, support for a long time. It's just, we don't know what kind of effects that losing a parent during a national pandemic and the grieving process, what kind of long-term effects that this is going to have. Next slide, please. So there are several aspects of the pandemic that we expect may have some long-term effects for children and adolescents. First, the academics. Children have been pulled away from their normal routines. Learning at home. Some children do great learning at home on the computer, but then there's the children with special needs that need that routine day after day. So pulling a child out of their routine, away from their friends, we expect to see some downfall of learning down the road from that. Then exposures from having family members sick. Some children have been sick. Exposures to death, exposures to possible violence at home. They may have been victims of violence themselves. And then losses of loved ones, losses of expected milestones that they've missed. All of these losses have been very traumatic for some of our children. Next, please. Lack of resources. There's a serious shortage of mental health resources, of health providers. And we've known this for a long time, but actually COVID-19 has really shined a light on this problem. A lot of our resources for children mental health services are delivered in silos with little coordination with other services such as social services, other medical services, educational services. And then a lot of the states don't have that population approach to promote, prevent, identify, and treat children's mental health. So, so hopefully after this pandemic, we'll know better and we'll do better. We'll learn from this. Next, please. So what is the way forward? We know that we have to have resources that support young people, their families, and schools. We have to provide culturally appropriate support programming and resources that meet the community needs. And there has to be fair access to services to families from all racial and ethnic minority groups. And telehealth. Telehealth holds it really holds a promising future for our children out there in those rural, low income, high risk groups and community. But it only goes so far if we don't have providers, to back it. And we know that it only goes so far if we don't have the technology behind it. We know that we still need the Wi-Fi and, and those areas too. So we have we have a ways to go there, but it holds a lot of promise in those areas. And then the Medicaid expansion program. As members of, if you've been thinking that, this might be the right time to start a program in your area for behavioral health, this might be the right time with the Medicaid expansion program. And Signet Health, we invite you to use us as one of your resources. We would be happy to answer any questions that you may have as the behavioral health experts. We would be happy and honored to help manage your behavioral health program. Next slide, please. But we do know that our children are in crisis, and these children are going to need interventions that can help them with their grief and ways that can prevent their mental health from becoming more severe and having more consequences down the road. Like I said before, there's going to be challenges that could emerge that we're not sure about because we don't know the impact of these children experiencing all this loss and having all this trauma during a national crisis. But we have to be prepared to respond with flexibility and compassionate programming. Now I'm going to turn it over to my colleague, Pat Scalfari, for the last few minutes. Thank you for your time.
Thank you, Tammy. My name is Pat Scalfari, and I am the Vice President of Clinical Services for Signet Healthcare. Just as we close Tammy's presentation, I wanted to invite everybody to look at all the things that we need to do to support our children's mental health. At Signet Health, we had the honor and privilege to work with a very proud, upcoming young man who was entering his senior year of high school. He was a great student, straight A student, no mental health issues. And then his school got closed. He had a really hard time dealing with this. At the same time, he lost his job. It was his first job. He was saving money for his own automobile. His mother was very involved in his upbringing. She was a single mom, and in fact, she was a healthcare provider. At work one day, she tried to text and call him many times. He didn't answer. So she sent the local police to do a wellness check. When they got there, he was actually near death. He had sustained self-inflicted bilateral wrist lacerations. He was treated in the emergency room. He actually went to the operating room for repair and then was on our behavioral health unit. And as we worked with her, she really admitted that many of these things that we see on this poster, she had noticed what were going on with her son for quite a while, but she really wasn't in tune to it. So we have the opportunity to provide great care to our youth at our facilities, and the need for this will be ongoing, not only into 22 and beyond.